my name is KAYLYNN VALE,
And my name is Elena Tanner.
and we are occupational therapy students at the University of Texas Health Science Center San Antonio. We completed a correlation between burnout and academic life satisfaction in healthcare students, specifically in the form of a burnout survey.
It is important to note some background information. Burnout is defined when an individual experiences psychological distress and starts to feel a lack of personal accomplishment. Prior research has shown trends between burnout and academic success, quality of life, and life satisfaction. There is a gap in research showing burnout and life satisfaction in the educational setting, specifically, how students perceive their overall academic life and goals. That is why we decided to do this study to investigate the correlation between academic life satisfaction and burnout amongst healthcare students.
The method we used was a descriptive study, specifically in the form of our burnout survey. We sent a survey to 908 students from the School of Health Professions at the University of Texas Health Science Center San Antonio. Of these, 145 students responded, giving us a response rate of around 16%. Important demographics to note is that a majority of the students were female, aged between 22 and 25, and the most common GPA of these students was between 3.0 and 4.0. This is important to note due to the fact that our survey was on academic life satisfaction. Our survey was comprised of two portions. The first portion was the Burnout Assessment Tool 2.0 scale, otherwise known as the BAT 2.0 scale. The second portion was comprised of questions developed by the Occupational Therapy Program class of 2026. We created the survey on a program called REDCap. Individual groups within the cohort used the unaltered BAT 2.0 scores in combination with specific student questions to complete their analysis. Data was analyzed using the BAT 2.0 manual statistical forms, specifically the Flemish, and for correlation purposes, a rash analysis was completed. If you draw your attention to the top graph, under results you will see the three questions we chose from the student developed portion of the survey along the bottom. On the left side, you can see the key that indicates yellow corresponds to the never answer within the survey. The answer choices continue from rarely, sometimes, often to always, as indicated by the color blue. Within each color, differences in shade of color indicate the level of burnout, with darker colors indicating very high levels of burnout and lighter colors indicating average to low levels of burnout. At first glance, the first question, I maintain a healthy school life balance, may look like it represents a bell curve or a normal distribution. However, if you look closer, you can see that the darker colors are more concentrated on the left side of the graph for never maintaining a healthy school life balance, and lighter colors more concentrated on the right side of the graph for always maintaining a healthy school life balance. This indicates a negative correlation between maintaining a healthy school life balance and having high levels of burnout. Inversely, the next two questions, I am proud of my academic performance and I think that I belong in my program, show a positive correlation. This can be seen by the significant concentration of high burnout students choosing answers toward the always side of the scale. It's interesting to note that the first question, when compared to the second two questions, had inverse correlations.
Please draw your attention to the infographic below. You will notice that the BAT 2.0 survey shows correlation with the three questions we felt express academic life satisfaction, including school life balance, performance, and belonging. It also shows the questions we developed that represent academic life satisfaction is statistically significant at the zero point zero 0.01 level, which is important to note that those questions accurately represent academic life satisfaction. To discuss this further, the majority of participants showed they were either high or very highly burnt out based on the BAT 2.0. The rash analysis shows that the survey questions related to academic life satisfaction were statistically significant at the zero point zero level and is two-tailed. This shows our null hypothesis is rejected and it didn't happen by random. Students who were burnt out perceived that they did not maintain a healthy school life balance, making this a negative correlation, while students who were burnt out showed they perceived they felt they belonged in their program and was proud of their academic performance. Further research should be done with the standardized assessment tool to measure academic life satisfaction, to have both constructs measured using a standardized assessment tool for a more targeted survey.
In conclusion, this burnout survey should have an impact within the occupational therapy community. The American Occupational Therapists Association, or AOTA 2025 vision, focused on health and quality of life for all people, students included. Because burnout can be illuminating factor for all students. Occupational therapists should consider the effective of burnout on academic life satisfaction and continue research in order to provide evidence-based practice to promote health and quality of life for all students. For any questions, comments, or concerns, or if you would like to see the references of this study, please feel free to reach out via email. Thank you.